Hello, this is Dr. Gay from First Look MRI, and this is a 15-year-old male who crashed his bicycle a week ago and complained of pain in his hip and hand. And on this view, we see his hip joint. This is his femoral head, nice and round. This is the acetabulum where it rotates. There's no fluid in the hip joint. His growth plate here of the hip looks good. So luckily, he had no fracture of the hip joint, no fluid in the hip joint. His hip labrum, this little triangle here, looks normal. So hip looked good, but out here laterally, the muscles here did have some injuries. So on this view, you can see a little bright band here. This is a partial tear of one of his muscles here. This is his gluteus minimus muscle, gluteus medius muscle. If we put on another view, this will show better the lack of symmetry here. The muscles on the left side, nice and dark and uniform. And on the right-hand side, we see this patchy brightness here. This is the gluteus medius muscle. And then the minimus that hugs this bone here, the ilium, look good back, posteriorly, but towards the front. As we go further and further anterior, we see this abnormal signal within the anterior muscle fiber. So partial tearing of the anterior fibers of the gluteus minimus and medius muscles. And there's also another muscle out here called the tensor fascia lata that was torn. We're going to put up another view in short axis. This shows it a lot better. We see the left femoral head over here on the left. Here's the right femoral head. This is the acetabulum, and the muscle injuries are right out here. Note on the left side, nice and homogeneous and uniform. On the right-hand side, we see patchy edema within the muscles. The gluteus minimus and medius. Both these muscles are foggy, and they're outlined by fluid. And the fluid tracks down here over the greater trochanter. This is the greater trochanter. And here's patchy partial tearing of the gluteus medius muscle there. Also, the distal attachment is poorly defined, and there's that fluid over. Now, as we go up higher, this is called the tensor fascia lata muscle. So we have two muscles, the gluteus minimus, medius, and then in front, tensor fascia lata. And the tensor fascia lata attaches to right here. This is the anterior superior iliac spine, just along the anterior margin of the iliac crest, and we see that the patient has marrow edema throughout that ilium, a little bit of edema in front of it. In front of the periosteum, we see this band of brightness, so a little edema or hemorrhage elevating the iliacus muscle there. And we see on this view a transverse band, this little fracture through the base of the anterior superior iliac spine. And again, that's where the tensor fascia lata attaches, and that tensor fascia lata and the adjacent anterior fibers of these gluteus muscles are partially torn. So that is his main finding. And there's another muscle that attaches up here, and this is the sartorius. So here's a sartorius here coming across, attaching right there. That's not torn. So sartorius is cool, but these other lateral muscles are partially torn along with his transverse fracture. So luckily these are muscle tears and non-displaced fracture. This should heal up with conservative therapy, but he's going to see the orthopedic surgeon to get some advice. The patient also had an MRI of the hand that included the wrist, and he had a little non-displaced fracture of his scaphoid bone there. It looks like a little curvilinear smile, a linear non-displaced fracture line. And also this bone right here called the capitate bone, he had a comminuted fracture of his capitate. So fractures of the wrist, and also the muscle tears and fracture of the right high hip. Thank you very much.